Welcome. Welcome everyone to Mental Health Colorado's Legislative Education and Advocacy Day. This is our 28th annual LEAD event, and we're grateful to have all of you with us virtually again this year. Whether you're tuning in through Facebook Live or Zoom, for the next hour, we are united with our allies for mental health. According to Mental Health America's 2022 ranking of the states, Colorado is the worst place in the nation for adult access to mental health care. Today, we're here to discuss behavioral health transformation in the 51st state and what reforms are urgently needed in Colorado to improve adult access to mental health care. There's only one way to go from here. Even as the new Behavioral Health Administration begins its much anticipated work, and even as new legislation enacts recommendations regarding the spending of pandemic recovery funds for behavioral health transformation from the American Rescue Plan Act, it's clear that improvements in access to care will come too late for Coloradans who are in distress today, and even for the distress that Coloradans will experience into 2023 and beyond. What we can all do as we wait for the cavalry to arrive is take small steps each and every day to support our own and each other's well-being. To mobilize all Coloradans on their own behalf, we've launched the What's Your Peace campaign. By sharing our daily well-being practices with one another, we reinforce our own commitment to making time in the day for the things that keep us well and enrich each other's toolkits. In a state where it is so difficult to access professional care, the urgency of self-care and providing peer support for one another can't be overstated. Emma will put a link to the What's Your Peace campaign in the chat. For their sponsorship of today's event, I want to thank Colorado Access, the Colorado Community Health Alliance, Health One, Johnson & Johnson, Mental Health Center of Denver, and Signal Behavioral Health. I especially want to thank our presenting sponsor, Rocky Mountain Health Plans. And I want to thank all of you for donating to the best of your ability when you registered for the event. We wholly depend upon the generosity of Coloradans to be able to persist with our advocacy work. With that, I'm going to turn things over to our host for the hour, Jordan Chavez. Many of you will recognize Jordan from 9 News, where he has brought mental health to the forefront since joining the station in 2017. He has also shared his own mental health journey with viewers, and he is a great ally of the organization and of our mission to achieve healthier minds across the lifespan for all Coloradans. Let's welcome Jordan Chavez.
Hey, Vincent, thank you so much. I appreciate it. I don't even know how many years this is that I've now been lucky enough to be part of this event. All I know is that anytime I'm asked back, I instantly say yes, because the work here of all the organizations that are involved in today, of everybody that's tuning in, it is so incredibly important because mental health impacts every single person on this planet, whether they know it or not. And oftentimes when you finally realize that you're impacted by it is when you need resources like the kind of organizations and the partnerships and the sponsors we have here today provide. And obviously we are trying to get better access to everybody at home so we can get that to them faster and certainly help them out. For me, it happened at 4 a.m. when I discovered that I suffer severe anxiety, when I couldn't move more than to reach for my phone to call my mom, and she had to listen to me cry and breathe just for the next 6 hours. And we did that on repeat for the next couple of months until we learned it was severe anxiety that I had. And thankfully, because I now recognize that and I know the resources that are available, we're able to manage it every single second of my life. And we would just like more of that for everybody, like I said, across Colorado, across our country, across the globe. So that is the mission of today. I could go on and on about why this event is so important, why these groups are so important, but we do have a really packed schedule. So I've been told I don't have all the time in the world to just discuss me. So we will get going. Before we get started though, I do want to let everyone everyone know and encourage everybody to send any questions that they may have for our panelists that we're going to get to in just a moment for the program. You can submit those through the Zoom chat, and we'll be going through those and trying to get them to our panelists as those come in. We're going to turn those in a little bit later in the hour, and then our speakers can obviously address every single one of those as they come in. With that, though, honoring us with her presence today, and to my understanding, her first public appearance since moving to Colorado, Dr. Morgan Medlock. Dr. Morgan Medlock, thank you so much for being with us. So she is the newly appointed Commissioner of the Behavioral Health Administration. Dr. Medlock previously served as the Chief Medical Officer and Director of Crisis and Emergency Services for the Washington, D.C. Department of Behavioral Health. We also know that she serves on the faculty of the Massachusetts General Hospital Center for Law, Brain, and Behavior at Howard University College of Medicine, and has held a previous appointment as a clinical fellow in psychiatry at Harvard Medical School. My goodness. I mean, if I thought I was accomplished right now, I'm going to move off to the side because clearly the spotlight is on you, Dr. Medlock. Thank you so much for being with us. We very much appreciate it. I'm going to turn it over to you now.
Thanks so much, Jordan, and good afternoon, everyone. It is my distinct pleasure to be with you this afternoon for this occasion. Thank you to Mental Health Colorado for inviting me to speak. And I have really enjoyed getting to know the Colorado landscape, and really have been impressed by the profound kindness of people in this state and their passion for mental health and transformation. So happy to be a partner in this. My name is Morgan Medlock. I am the recent appointee of Governor Jared Polis to serve as this state's first behavioral health commissioner, and it is truly my honor. I understand that today we really want to understand more about my background and who I am as a person, so want to start with that. I grew up in Texas, and actually my family has operated crisis mental health centers for nearly 2 decades. Even though my parents were not clinicians, they actually took an interest in mental health from a very young period of my life. And so I grew up with that atmosphere, not knowing I would end up being a psychiatrist. I am indeed an emergency psychiatrist and an addiction specialist, and I have a background in health policy as well as divinity training. And most of my academic career has been around developing equitable systems of care for marginalized populations. And we also speak boldly on our team about anti-racism work and health equity. And that has also been a focus of mine. In Washington, D.C., I served at Howard University, and will tell you a little bit about that work and how I believe it prepares me for this role. There, I was really the director of community engagement and new program development, and we were tasked with developing lines of communication and empowerment from the Department of Psychiatry to residents of Ward 7 and 8, which were really one of the most disadvantaged and marginalized wards in Washington, D.C. And what I was reminded of during that engagement process is that individuals whom I spoke with shared that if we want to put people first in our healthcare systems, that we first have to consider the communities they've come from, because they're a product of their community. And so through that engagement work, I began to really take up the mantra of needing a structurally competent healthcare system where we not only think about social needs and social determinants, but the structural and community determinants of those needs, meaning how economic policy, how social policies, how political factors then contribute to the well-being of communities and populations. And so that is the spirit I bring to this work, is putting people first by putting communities first and continuing the legacy of community empowerment and engagement and stakeholdering that has really been a part of this process for the past 2.5 years. So I believe our paths have crossed for a moment in history that I believe will leave an incredible legacy. One of the things I want to share just in terms of my own personal compass as I partner with you in this transformational work is I bring a lens of thinking about the whole person, thinking about people as more than consumers of services, thinking about people as more than their diagnoses or challenges, but truly recognizing they're individuals with mental, physical, and spiritual needs. And as you know, one of our pillars of reform has been to design a system that considers the whole person. I also want to talk about how I view it as critically important to balance an emphasis on evidence and data with empathy. And I boldly identify as an empathic policymaker, meaning that as commissioner, as I've been asked to opine and provide input to our legislation that I'm considering is, am I contributing to a system of care that I would want my own family member to experience? And that is a guiding principle of empathy on a daily basis. I want to also just highlight how hopeful I feel about the work we're doing. As our CEO has shared today, we are certainly in an urgent moment, and we certainly have to develop solutions quickly. And we need to do that work together. And yet, when I took this role, I didn't feel that I was coming into a state of deficit. I truly felt that I was joining strong partners across the state and advocates and families and individuals who could really speak to their hope and resilience. And I have seen that. You may be following on LinkedIn and you may have noticed that we have initiated our statewide tour. And we started out in our crisis environment where we really want to ensure we're standing up a crisis center as the first door to treatment that really serves all Coloradans. And there I realized that people in direct care across the state who are serving Coloradans every day really have a will to do the right thing. And that is encouraging. And as someone once said, where there's a will, there is a way. And I believe that our way forward is really to continue the path that has been really championed the last 2.5 years of engaging in local and county engagement, of continuing to center the voices of people with lived experience, of continue to be devoted to equity and community empowerment. I want to just, for the next few moments, before we transition to our panel, share with you how I think this vision comes together. As has already been acknowledged, we have a lot to do, and the behavioral health bill that is moving forward really gives me as commissioner authority to really stand up a behavioral health system over the next several years, and we intend to be fully operational by July 2024. That being said, our first day of operating, opening day, if you will, is in fact July 1 of this year. And so I just want to share with you a few wins, a few goals that we are hoping to accomplish and announce on our first day of operation. Continuing with the theme of community empowerment, we are hoping on day one to announce our advisory council members, which will be represented by advocates, families, et cetera, across the state. We want to be sure to have representatives from marginalized populations, individuals who have lived experience, and we would like to announce on day one the members of that council, again, showing our commitment to continuing to center the voices of individuals with lived experience. I will also share that it is my hope that that council can actually host meetings across the state on a rotating basis where prior to council meetings, individuals who live in that region can meet with me and our administration, and then we can host our actual council meeting in a way that is viewable by the public. And so that is a strong accountability measure that we are committed to. It is my goal to have that council be co-chaired by a person with lived experience. It is also a goal that that council would serve as more than a passive listening role, but rather an active partner in policymaking and leadership. The second win for July 1 that I'd like to share with you is we would like to, as an incremental step to developing a comprehensive care coordination platform, which we know is so needed for individuals who are at risk of falling through and experiencing gaps in care. As an incremental step to that, on day one of our administration, we would like to publish publicly a comprehensive treatment directory, which integrates private and public providers so that individuals can know what, as we call it, exists in the behavioral health universe. And we want to bring together providers on one platform, irrespective of payer, et cetera. So that's another goal. And our third win for July 1 is we would like to be accountable to you as the public. We would like to be accountable to you with a public-facing dashboard that shows our progress in implementing the reforms and priorities that you have established over the last 2.5 years. We continually remind our team that the people have spoken, and as long as we continue to put people first in this process and remain accountable in a public and in a transparent way, that we will get this right, and that is our goal. I want to share just a bit about equity as I close. Equity is really the center of our work, and we know that we have a lot to accomplish there in addressing racism and economic inequality and other structural determinants of health. And I am so glad that we received an outpouring of support for the fact that our administration has already taken up the goal of sponsoring 5 equity fellows in the College for Behavioral Health Leadership's Equity Grounded Fellowship Program. And we will soon be announcing those 5 fellows that will again be centering the work of equity within the BHA, but also taking back their skills to their communities across the state. So we're excited about that. Well, in closing, I will say that today marks day number 30 on the job. And I am deeply encouraged to be able to partner with such passionate advocates, where I believe that when we get this story right and when we put people first, I believe and I know that Colorado will actually become a top 10 state in mental health. So I'm inviting you to continue to partner with us as we make history together. Thank you so much for having me.
Day 30 on the job and already winning a lot of people over. Dr. Medlock, thank you so much for your insight and for really addressing mental health in a way that I think a lot of us have never heard it addressed. And we're looking forward to your work, and already judging by what's being put in the chat, a lot of people are looking forward to being part of that mission. So Dr. Medlock, thank you so much. Along with Dr. Medlock, we are excited to get to our panelists, which we will do in just a moment. But first, we do want to get to a clip from our presenting sponsor, Rocky Mountain Health Plans.
Hi, Meg Taylor from Rocky Mountain Health Plans in beautiful Grand Junction, Colorado. I do not have a teleprompter. I'm going to be reading from my phone because these are important words to talk about why we're sponsoring the Lead Day in Mental Health Colorado. It can be done. Timely, personalized behavioral health access and choice can be made available to all Coloradans, regardless of their coverage status or personal means. People with co-occurring diagnoses, dual diagnoses, severe and persistent mental illness, any diagnoses, any needs whatsoever. Strong leadership and commitment by policymakers at all levels and in all communities throughout Colorado is driving change. We have a tremendous opportunity to reform the current delivery and financing system for behavioral health services and drive improved accountability to communities for access, choice, and outcomes. We will never stop investigating gaps in care, but we have learned enough to take action now. It can be done. Behavioral health is health, not something that is specialized nor something that is different or unique. There is no place for bullying in behavioral health. Behavioral health is not something done by someone else, somewhere else, for someone else. All health care providers are in the business of behavioral health. Behavioral health is all of us. We all have a right to behavioral health care and well-being. We can do better in Colorado. It can be done. Behavioral health is up to all of us. It takes everyone, independent providers, traditional providers, law enforcement, human services, healthcare systems, primary care, county leaders, community stakeholders, schools, educators, consumers, taxpayers, and voters. Behavioral health care requires inclusion, transparency, and performance. We are all the safety net. The time for change is now. The time for leadership is now. The time for courage is now. Stand up for your friends, your neighbors, and your loved ones. We demand better. We stand for better. Please stand with us and Mental Health Colorado in our mission. Thank you.
And a big thank you to Rocky Mountain Health Plans. We very much appreciate the work that they are doing as well. And now we are excited to turn things over to our panelists. I'm very excited to introduce them to you. So in addition to Dr. Medlock, we have Kristen Bates, Population Health Division Director of the Health Programs Office at the Colorado Department of Healthcare Policy and Financing. We also have Kate Harris, Chief Deputy Commissioner of Life and Health Policy at the Colorado Division of Insurance, and Summer Gathercole, Acting Deputy Commissioner of the Colorado Behavioral Health Administration. We thank all of you for giving us some of your time today. We know we're excited to hear exactly what you have to say. Before we get to the questions that everybody else is coming up with in the chat, we do have just a few prepared questions that we were hoping you could address first. So we'll start with the order that I introduced you in. So Kristen, if you don't mind, and then I'll ask the same question to every other panelist as well. But if you don't mind, Kristen, start us off by letting us know what we can expect from the BHA.
Yeah, absolutely. Thank you so much, Jordan. And thank you, Vince, and the Mental Health Colorado team for inviting us here. I'm so excited to hear Dr. Medlock speak. We're up here as panelists, but as inspired as all of the attendees. And I'm really excited about the movement towards the Behavioral Health Administration. I previously worked at the Office of Behavioral Health. Now I'm over at Healthcare Policy and Financing, our state's Medicaid agency. And I think one of the things that you can expect from the BHA is really that accountability and transparency that we've been really hoping for. But I want everyone to understand that you're going to expect to be HCPF there by their side every time. Our Medicaid agency is our state's largest payer for behavioral health services, and we see our relationship as one of a few very, very essential state relationships across the healthcare agencies in Colorado. So as the Behavioral Health Administration starts to make changes by changing some of our standards, changing some of the expectations for our providers, creating more resources for our patients and for our clients, creating statewide resources that are available to providers so they can improve their capacity, training, all of that work. What we hope is that Medicaid is going to be right there behind them with the financing to sustainably support this work. So that's something that we really, really are looking forward to, is partnering with the Behavioral Health Administration to do more jointly funded projects, to do more efforts, to prepare more efforts around value-based payments, in which we are moving towards paying for value, quality, and outcomes, and not just volume of services. So I think that I'm very excited for some of the changes that are happening. It might feel like a lot of the behind the scenes, but for some of us who've been in government for a while, it really makes a difference in the administration of these federal funds, of the benefits that we have in Colorado, and getting people the support that they need so that they can access quality care in a timely manner.
Kristen, thank you. Kate, I'd like to pose that same question to you. A lot of people in chat seem to be excited about some progress happening that they feel they have not seen in the past. So from your role, how is the BHA, what can we expect from them?
Yeah, thanks so much, Jordan, and thank you to Mental Health Colorado for having me on the panel today. I will echo a lot of what Kristen said, really, both just so inspired by Dr. Medlock and looking forward to getting to know her and in her role. And Summer and Kristen and I have been involved in the last couple of years with the task force and all of the conversations around really how to make sustainable systemic change in Colorado. And from our perspective, I'm at the Division of Insurance, so we oversee the commercial market for health insurance in the state. And, we hear a lot of similar things and issues to what Kristen mentioned in terms of folks not being able to, find access to care and really struggling, whether that be in a crisis moment or ongoing, not from providers who are having trouble getting credentialed with a commercial carrier, and how can we make those processes better? I think so much of the work already has been just this ongoing conversation, but coordination and really strategic alignment between the agencies as we look to align with the BHA. And, so that really, if you're a person looking for care, regardless of if you're have public or private insurance, or if you're a provider who sees patients that, have a variety of insurance types, that you're really able to both access care on the patient side and provide that care on the provider side. I think the BHA is just going to be such a critical, important agency in terms of getting alignment across programs and payers to move forward.
And Summer, I'll pose the same question to you. Appreciate, Kate. Thank you so much. By the way, really quickly, Summer, before you answer, it looks like Dr. Medlock is being pretty proactive in answering some of the questions you are typing into that Q&A feature. So as you're listening to our panelists, you also can type those questions in there. Dr. Medlock, appreciate you doing that. Summer, again, I want to get to that question with you now. What can we expect from the BHA?
Yeah, thank you so much, Jordan, and many thanks to Mental Health Colorado. It's just such an honor to be with all of you today. And I too am very, very excited to be with Dr. Medlock. I've been with her every day for the last 30 days. And it's just so inspiring to see what the insights that she is bringing here to Colorado and the energy that she's bringing to make sure that we move forward. When I think about what we can expect from the BHA, I'm going to just repeat two things that Kristen said, but I'm going to go just another level deeper. It's all about accountability and transparency. And so for accountability, part of that is about making sure that we as the BHA are keeping ourselves accountable, our sister agencies accountable, our providers accountable. But if we go down another level, I think about it in terms of reflecting on some of the public testimonies that we heard through the governor's behavioral health task force. And I specifically remember, one mom coming in, sharing her story about she reached out to one government agency, she got bounced around. She reached out to another provider, she got bounced around. Someone finally said, oh, if your son's in jail, talk to the jails. We're not the people to talk to. I mean, she just had this horrific experience as a first time. And she went through that multiple times. And every time she got a little bit better because she learned who were the right people to talk to. And she came in, she had, a notebook 2 inches thick of all the records of all the people that she had spoken to. So when I think about accountability, I think about it as like, that can't happen anymore, right? We have to stop the not it game. We have to stop oh, that's not my work, that's your work. And that's part of what the BHA will really be responsible for. The other piece that I'll talk about is the transparency piece. And certainly much of that means, us being able to say with much more clarity, here's the dollars that are being invested across the state, and here are the outcomes that we're seeing. And at a much more kind of personal perspective, it's actually really about making sure that people's lives are better when they interact with our behavioral health system. And that's really what we want to aim for more than anything else. So when we think about accountability and transparency, it's, stop the not it game and really make sure people's lives are better and improving because of their interactions with the system.
Summer, thank you so much. As you guys were just talking about, that is what we can expect from the BHA. Now I want to pose the question, because we know that every single person in the state really has a part to play in helping us improve accessibility for these resources. So Kristen, I want to start back with you again. As far as the BHA goes, what role do advocates and peers and families really play in implementing the BHA?
Yeah, so I think what you guys are going to see is this year there's going to be a bill that's going to be coming out maybe in the next week or two. That's going to be pretty hefty bill. You're going to see a lot of information in there, but really pay attention to what's in there. There's a lot of changes about implementation. And if you have questions, if you'd like to see what that means, please engage in some of those stakeholding events around the actual bill so we can pass the bill to move forward and implement some of this work. I would say the other big thing that we have is, the BHA is coming at a time where we also have an extraordinary opportunity because of American Rescue Plan funding. So in a time where we are going to have a really difficult time just asking people to make changes without a lot of resources, we now have so many resources we can dedicate in the short term to achieving that change. And so there are a lot of work groups that are going to happen around that, like at Healthcare Policy and Financing. We're working with, I'm going to call them the BHA. They're still an Office of Behavioral Health, but we're working with the BHA now. And we're working on changing the way that we do mobile crisis, right? Healthcare Policy and Financing doesn't have an actual benefit for this. So we're going to be creating a benefit. We're going to be working with the Department of Public Health and Environment on these new secure transport vehicles so that folks in a crisis are not having to be handcuffed or put in the back of a police car just for having symptoms of their illness. And there's going to be a lot of stakeholding around that in public. We also have a couple of programs and grants. So we need you all to apply for the grants. We need you all to take our money. We have so many opportunities for us to build capacity, and it has to happen at that regional level and at the state level, and we have to do it simultaneously. So I think that that's something that's really important is pay attention, sign up for our newsletters. I'll throw a couple of links in the chat on our rescue plan dollars for Medicaid. But it's important to just kind of go to the behavioral health reform page, sign up for Summer puts out amazing newsletters, and track on all of this stuff so that when the money comes, you're there and you're prepared with some great ideas on how you're going to build capacity in your community, because we have to do that while we're making these big transformational system changes. Our local partners on the ground are where we're really going to see change for individuals on the day-to-day.
And really quickly, before we get to Kate on this question, just a couple of quick follow-up questions for you, Kristen, that we have from a couple of people who have joined us today. First of all, that bill that you were talking about, for anybody who would like to follow the progress of that, what is it called so that they can track that?
Oh, it hasn't been introduced yet. So in the next 2 weeks, you're going to see the bill number and the title, which I'm assuming is the creation of the Behavioral Health Administration, something along those lines. Right. And maybe Summer could give us maybe Summer could let us know who the sponsors are.
Absolutely excited to share that our sponsors are Representative Mary Young and Representative Rod Pelton. They have been such champions for this work, over the past couple of years, and just really, really grateful for their continued sponsorship and support.
All right, so we'll keep our eyes peeled for that bill in the next couple of weeks. Also, really quickly, Kristen, you were talking about these grants. People are saying that they're interested in applying for them. Where can they go to get more information if they're interested in signing up for that or trying their hand?
I am going to throw some links in the chat, but I don't know about you all. The way I look for things is I Google them. If you Google Behavioral Health Reform Colorado, you're going to find the CDHS, soon to be BHA page. If you Google Healthcare Policy Financing, ARPA, American Rescue Plan Act, you're going to find our site. I'm going to put both those sites in the chat, but that's where you can sign up for newsletters, and we can give you updates on when those dollars are coming. They're coming as soon as, I think the earliest ones are coming in June, July, and then they're going to be slowly coming out over the next year.
Perfect. Thank you so much, Kristen and Summer. I appreciate you kind of bearing with these additional questions that we have. Kate, now I would like to get back to that original question as far as the role that advocates, peers, families, everybody plays in implementing the BHA.
Yeah, absolutely. So at the Division of Insurance, we have a what's called a consumer services team, where we have a team of people who take complaints about insurance companies and work to resolve them with consumers. And so one of the ways that it's really important for folks to contact us and to let us know, what you are struggling with, particularly, for those with private market insurance, my team will work with them and work with you to resolve that issue, hopefully. The way that we, as we work towards these bigger systemic transformational changes in our division, that, when we see something that comes in multiple times, different complaints as they come in, we stop and we say, hey, there must be something going on here, broader or deeper, and how can we make more regulatory changes and work with our insurance carriers to have people have greater access to care. And so as we partner with the BHA as it gets stood up, a lot of those things, it's so important for us to be aware of really what consumers are struggling with. And, while we hope that we get to a point where we don't have to put the onus, on the consumer and on the patient to, seek out their division of insurance, at the same time, we want and need to hear from people so that we can make those systemic changes, so that hopefully they won't have to come to us, in the future because they are getting better access to care.
Appreciate the answer, Kate. And Summer, I'll let you answer this. And then I want to get to some of the questions from everybody who's joined today, because we are getting a lot in. So Summer, I'll have you answer this one, and then we'll move on to those.
Sure, sounds great. And I'll share an example of something we did last year, which is in early 2021. We worked with, we did some non-traditional outreach to kind of some unusual partners, and we're able to identify Coloradans from across the state, everyday Coloradans, who helped us kind of design some care coordination. This was way before we thought care coordination was ever going to be on the table anytime soon. We were just trying to do some foundational research to really hear from Coloradans. What do you want to experience with care coordination? What does that mean for you? And the first meeting that we had, which of course was virtual, it was so incredibly powerful because we had people who were participating who had never been asked to participate in this kind of forum before. They felt honored, and we were honored for them to be there. And the work that they did over a series of months really informed the care coordination, some of the care coordination models that you're going to see reflected in the bill. So, I mean, that is a great example of how we were able to really engage people from across the state and have them help us design our system. And that's exactly the type of thing that we're going to continue to do. I did put our webpage in the chat box. Definitely encourage everyone to keep an eye on it. All of our meetings are open to the public. I'm sure when the advisory council starts, as Dr. Medlock said, we're going to be going around the state. Those two will be open to the public. Really want everyone, even if you're not on the advisory council, listen in, come to those meetings, share your thoughts, hold our feet to the fire to make sure we're doing what we said we're going to do. So those are all the ways that we really hope that people will get engaged and stay engaged.
Summer, appreciate it. You heard her say, hold their feet to the fire. I mean, some of the questions that are already coming in, definitely already trying to do that and look for progress that they feel they have not seen in the past. I want to get to this first viewer question. And first, before I get to this, would just love to say, this is why we have this panel. It's to talk about the progress. So we are going to get to some of these tougher questions from everybody that you guys are asking, and we're going to let our panelists answer this. And some of these are really tough, but this is why they're here. They want to answer these questions. So that first one that we want to get to, and I'm going to read it verbatim. I'm not going to censor these at all. There are a lot of buzzwords being thrown around here, and a diversion from the fact that we are 51st in the nation for behavioral health. This is abysmal. Can we get a little less enthusiasm and get into some concrete ideas that you have? $550 million from the CARES Act is huge. How can you help people now? And what state are you modeling behavioral health after? And I will let you decide who would like to take that question first.
Thank you.
Yeah, go ahead, Dr. Medlock.
I was going to recommend, Kristen, if you would mind just providing some concrete details on how we're using ARPA funds and the recommendations of the transformational task force. Thank you.
Thanks. So I worked really hard with a group of legislators and executive committee folks from August until January, and that's following the Behavioral Health Task Force on how to identify the use of the $450 million. There was $100 million of rescue plan dollars that was put out last year that's being used for care coordination, recruiting peers so that we can have a better workforce from more diverse areas. There's a lot of county funds that are going directly out into the community. And then we had 7 recommendations that came out of the Behavioral Health Task Force for the 450 million people, $450 million. So that includes funding for American Indian and Alaska Natives for residential substance use treatment in a way that's culturally competent. That includes integrative and innovative care at primary care sites and in behavioral health providers so they can provide primary care, because we know individuals with severe mental illness die up to 25 years earlier than those who don't. We have funding across the care continuum for youth, including a neuropsych facility for individuals with co-occurring autism spectrum disorder, and as well as funding for outpatient and inpatient services for high needs kids. We have funding for beds. I saw somebody ask questions about beds. We have inpatient beds. We have sober living beds. We have adult adult beds for individuals with severe mental illness. We have beds for kids. We have, there's a lot of funding in there for that. But the beds are going to be only matter. The beds only matter if when you get on the other side, when you finish your stabilization, your crisis, you have the services that you need in the community. So there's also massive community grants, and that's $150 million at least going out to community grants. And that's going out for the purposes of diversion from criminal justice, better crisis response in a more clinical way. So you're getting treatment and not arrests and not warrants. There's funding in there for, I'm trying to think the rest of them off the top of my head. There's a lot more funding for care coordination to be managed by the BHA. And this funding is going to come out in different ways. So like I said, there's some that's going to be out as soon as we can get it out the door, we're going to get it out the door to communities. And then there's system changes that we need, right? And that change takes longer. It takes, you should expect 23, 24, 25 to all be big years for changes in behavioral health. In regards to the enthusiasm, I don't know what to tell y'all. I got to say, I'm very excited and I'm very hopeful. I was not enthusiastic when my brother was dying almost of a substance use disorder. I've been through this. I've been through what it feels like not to be able to get timely care for a loved one. I've been through days when I couldn't work because I was too busy worrying about my brother on the streets. And he's healthy now. And he's healthy because he got on Medicaid, and he's healthy because he got quality care. We need to make that the standard. And I want you all to understand that just because I'm smiling and I'm a fairly positive person, that's just who I am. That's not to be dismissive of the very tragic and just exhaustion that comes from loving somebody who has behavioral health needs and can't get them when they need them, or being an individual who has behavioral health needs and can't get services. All of this doesn't matter if we don't have timely access to quality care. That's the point of everything.
Kristen, a lot of people definitely thanking you for the words that you had for them. All right, would any of our other panelists like to address this question before we move on?
I think Kristen said it really well. Yes, there is definitely enthusiasm around this work, but we know that there is significant and substantial work ahead of us. It's not to dismiss the challenge of where we are at right now. People are struggling, absolutely. And there's a lot of work ahead to get them better access to more, quality, affordable care that can treat their diseases.
And I'll just jump in real quick, Jordan, if that's okay, just to say, same thing, recognize that this is systems change. And so it's hard because it is, the Behavioral Health Administration in some ways is what it sounds like, right? It's administrative in nature. It's about making sure that we get our house in order to be able to deliver better services across the state. And that's going to take some time because we invest $1.5 billion in public behavioral health across the state. It's not to dismiss the big need that we have now, and I know at least on the Office of Behavioral Health side, we're trying to do things like the I Matter program to ensure that youth have access to free behavioral health services. We've also been making grants to local communities across the state. And those are steps that we're taking, but there's a lot more steps that we have to take in order to ensure that people have access to services. And a big piece of that is also our workforce and making sure that we expand our workforce.
Thank you so much, Summer. I appreciate it. And I do apologize because this is a time-limited event. We only have a couple minutes left in this Q&A portion of the event. So I want to get to just one more question that's been asked by quite a few people that have been watching today. So maybe if I can just get one person to answer this briefly, so and then we'll move on to the next portion. But consumers are struggling with being aggregated into the criminal justice system because, quote, that's where the money is. So how will you work to shift funding streams?
I can jump in and just share. I think a big piece of that is ensuring that we have the community services available to the people who need them so that they don't have to go to jail to access services. And that was one of the big values that came out of the governor's behavioral health task force. Part of the work that the Behavioral Health Administration will be doing, and I think some of what will be reflected in the bill that you'll see in a few weeks, is really looking at how do we expand the number of providers? How do we make sure that we are providing services across the continuum in all regions of our state and in different ways? So there's a lot of work to be done there, but certainly we want to make sure that we build up our community services so that people have access to them and they don't have to go to jail to access them.
Mhm. And if I can add fairly as quickly as I possibly can,
Actually,
behavioral. Oh,
sorry, I was gonna say, we've expanded the time to 12:58 now for questions. So if you have more that you would like to add, please jump in.
just on the funding piece, since we do have $1 billion. That's how much we pay annually for behavioral health services, and that's $400 million more a year than we were paying 5 years ago in Colorado for Medicaid. So one of the ways that we're looking forward to partnering with the BHA on these changes is updating some of our definitions of what is a safety net provider. Safety net providers, because they do the work of serving people who have higher needs, providing more coordinated care, and meeting some other standards that the state sets, they should be entitled to an enhanced payment. So the way that we see things is that it's our job to make sure that safety net providers have enhanced payment methodologies. So what we're working on is we have some ways that we do this, but it's not really as equitable as we'd like to see it at this point. We'd like to have more equitable payments, less variation across provider types, but also recognizing that some providers who are providing one-on-one therapy might have a different rate than somebody who's providing one-on-one therapy and a drop-in center, and they've got crisis services, and they've got a psychiatrist on duty, and they've got medication supports. So it's important that we recognize that we're reimbursing safety net providers who are serving individuals of the highest need, that we're paying them appropriately, that we're attracting people to the space. And I know that's a frustrating part of being a Medicaid provider right now, and I promise we're working on it. It takes time. There's a lot of federal approvals, but we are absolutely committed to moving in that direction.
Kate, I'm going to give you an opportunity since now we have more of a time limit. If you want to jump in, feel free. And if not, no worries. We'll move on to the next question because we're getting a lot of great ones.
I think Summer and Kristen captured it well, so keep going.
All right. A great question that we have, because we are at this LEAD event. By the time we get to LEAD 2023, what is the best case scenario for where we are going to be? What is your vision for the next time that we gather here next year? What would you like to be talking about? What would you guys have liked to accomplish by then? Kate, we'll start with you.
Sure. I will say that the BHA is well on its way to being stood up and running, and that we are starting to see these shifts and transformations that we're talking about be put into place, and we are getting feedback from the community on what steps are being put in place and how those are going. I think to Summer's point earlier, we're getting the accountability mechanisms up and running, and so that Coloradans can actually see the changes that are being made, many of which are hard to see and track right now, and that we are being transparent and accountable for this to be, set up to be really long-term change, and not just a one-time shift, but this will be ongoing and lasting for Coloradans.
Thank you, Kate. Appreciate that. Kristen or Summer, would you like to jump in on that as well?
I actually think Dr. Medlock probably has a vision that she'd like to share, so we should hear from her.
I agree. Dr. Medlock, you have the floor.
Thanks so much. Next year, this time, the Behavioral Health Administration will be operational at the very least with 2 deputy commissioners, and including a deputy commissioner for equity, as well as our 6 divisional directors. We will have a data strategy that is holding us accountable to ensuring access to care across the state. We will have a launched council that is providing leadership and input to policymaking. We will have a universal contract for how we engage and administer behavioral health services. I, as commissioner, would have formed strong relationships across state government and agencies in thinking about a consolidated and consensus plan for how we move forward equitably and in an accountable way. And I believe that even next year, we will no longer be the 51st state. I think we will be talking about how we continue to climb the rankings in ways that mean something to our families and friends and neighbors. So I think even next year, next July, we could be in a very different place. And we will be if we continue to center the experiences of people in this work. Thank you.
Thank you, Dr. Medlock. We appreciate that. And kind of along the same lines, of course, we're talking about the work that needs to be done, but of course you need people to be able to do that work. So we're getting a question now that says, how will the need for more behavioral health professionals be addressed?
Yeah, I was actually just getting ready to answer that one in the chat. So I'll start off because I think that's a huge one. First of all, every single program that we need to be working on needs to have a workforce lens to it, right? Just like health equity is a part of every single thing that we do and not a separate issue, workforce is one of those things that needs to be embedded in all of our programs, all of our pathways forward. There's $80 million that's being set aside specifically for workforce plans through the Behavioral Health Transformational Task Force. And that includes a number of things. So that includes like long-term things like let's pay for people to go get their clinical training, right? Let's do loan forgiveness. Let's do scholarships. Let's make sure that we're recruiting from the communities that we are serving so that our clinicians look like the people who are in their community, right? Let's make sure that we specifically identify, you know, we talked about anti-racism, some of the historical racism and sexism and other challenges that people face when they're getting services, getting into clinical services. But then we also need to make sure that we're paying for different service types. So that means paying for people who are like peer advocates, right? Those are people who've gone through this themselves, but also behavioral health aides and community health worker programs. Those are individuals who they may or may not have completed treatment themselves or gone through a personal experience, but they're able to, without a license, without that standard of getting a license, be able to support individuals. I don't know about you all, but when like I said, when I was going through this, some of the most important people that helped me did not have degrees in behavioral health professionals. But geez, I really needed a Dr. Medlock as well. We need to make sure that we have these multidisciplinary teams that can allow Dr. Medlock to practice psychiatry, and an addiction medicine specialist to practice addiction medicine, and let folks who don't need a clinical degree to say, hey, let's talk about how we're going to make sure that you and your kids are fed this week. Let's talk about how we're going to get you a better job and some education. So I think all of that it really needs to be coordinated. And again, can't stress this enough, short-term and long-term measures. If we keep doing these Band-Aid plans, we're going to be here again in 10 years. And we're going to be here saying, why haven't we fixed this yet? We got to do short-term relief and we've got to do long-term systemic change.
Kristen said it well. If I could just add that I'm excited to share that any day now, we will be posting the first statewide behavioral health workforce development director. So someone who will be looking across the state at our workforce needs, looking at these recommendations that have been put forth and making sure that we have a very strategic approach in the long term and the short term. So it's a big step for Colorado.
And then I'll just add in from the commercial market side, much of our work is around making sure that insurance carriers are paying appropriate reimbursements and that those are in parity with what they are paying for the medical and surgical care that they cover benefits for as well. We have a lot of work to do there. We have 4 ongoing investigations right now. Part of those investigations of carriers have been looking at reimbursement rates. We hope to publish those this summer. We plan to publish those this summer. We know from the 2019 Milliman study that there is a likely very strong disparity in what behavioral health providers are paid when you compare them to outpatient medical surgical providers. We have to do better so that there are more behavioral health providers coming into the workforce and that they're reimbursed appropriately.
And now to another question that kind of goes back to a question we previously addressed toward the top of this Q&A portion. How will the mental health professionals who deal with those in the criminal justice system interface with your organization?
Hi. Sorry, just for context, and then I'll allow our esteemed panelists to jump in. But just for context, Jordan, right now we are moving around the state and embarking upon a statewide tour, and I am most attuned to the needs of our crisis system. As you know, that's my particular area of expertise, but also I'm interested in that because we know that the reforms that are needed cannot all wait until 2024. And one of our goals is to stand up a crisis system that is able to address some of these needs immediately, and especially those who are at risk of entering justice settings. So Jordan, we're still in the process of assessing the crisis context here in Colorado, which is somewhat different from the states I've served in. And we hope to make some substantive recommendations and changes there so that it will be meaningful to individuals who are at risk of justice involvement. Thanks.
And if I can just expand on that, I think part of what we learned in the conversations from the past year is that there is, as we all know, an intersection between our behavioral health systems and our criminal justice system. And we have not always been good partners, and I think we have worked very, very closely over this past year to ensure that we are aligning our efforts better within the Behavioral Health Administration. We expect to have liaisons who are working with the criminal justice system and the judicial branch. And that's also going to be reflected in the bill that comes out in a couple of weeks. So again, that will really to reinforce, again, holding our feet to the fire of we need to make sure that we have those partnerships and that we're working together.
And also,
So sorry, Kristen, that's my fault. Please answer.
Just one more thing. I think that one of the things we really need to work on is prevention, right? 3 years ago, and well, let's see how, don't count me, 5 years ago, 2017, 2018, we finally were one of the last states in the nation to pass a bill that prevented people, with the help of Mental Health Colorado, that said you can't hold people in jail for having behavioral health needs. That's how far behind we are. And so we really need to be working on, yes, for people who are involved in the criminal justice system, we need to get them help, we need to be supportive, but we also have to prevent people from getting arrested in the first place for having behavioral needs. So I think that that's really important, and we're working on expanding our co-responder models that are non-police involved. So those that involved emergency medical technicians, EMTs, ambulances, things like that, so that we can get clinical services into the community when somebody's having a behavioral health crisis instead of sending police. And it's essential that we work with 911 operations and dispatch to do that. So again, that's something I'm pretty excited about, and I think will really be making a big impact long-term on how we serve individuals in Colorado.
I want to thank all of our panelists. Unfortunately, we are wrapping up in this final minute of today's event. So I wish we had all the time in the world to address these questions. There are so many. Really quickly, for more people to learn about the Behavioral Health Administration, is there a place that they can go? Maybe if they have follow-up questions to it. I know Dr. Medlock, you were talking about the tour that you guys are doing around the state. Is this something that people can attend, and where can they find that information?
Thanks, Jordan. Great question. And then I'll pass to Summer, who may have some more specifics. But as I travel around the state, I'm delivering via video a 1-minute message. And so the first 1-minute message was released on LinkedIn from Colorado Crisis Line. And our equity directors are sort of putting together a strategy for how and where I visit and how we do that. And we certainly want to make sure that all communities are represented. So those videos are posted currently on the Human Services social media platforms. And then I usually will reshare those on LinkedIn. And then Summer, if you could provide some additional details around our website that we're attempting to stand up by July and so forth. Thanks.
Absolutely. So we will have a brand new website for the Behavioral Health Administration that will be shared in July. In the chat box, I put a link to our specific Behavioral Health Administration webpage. On that webpage, in addition to kind of frequently asked questions, there is an opportunity to submit questions, to give us suggestions, share your thoughts with us. So definitely encourage you to fill that out. You can put your name or leave it anonymously. We look at those questions every week, and then we update our webpage with the frequently asked questions as we get those in. So it's updated weekly. Definitely encourage you to submit your info or keep an eye on the webpage for the latest information.
Basically, don't let this be the end of your questions. You guys have so many great questions out there, and we thank you so much for them. We want to thank Dr. Medlock, Kate, Kristen, and Summer for their time today and answering the ones that we were able to get to. I apologize if we were not able to, but again, keep those coming. There's going to be somebody that will be able to provide you that information. Thank you guys so much for your time. I appreciate it. I do want to go ahead and turn it back over to Mental Health Colorado President and CEO Vincent Atchity one last time.
Thanks, Jordan. And thank you so much, Dr. Medlock and Kristen and Summer and Kate for being with us today and for all the hard work you've been doing and will continue to do. Many thanks to all of you leaders, advocates, and allies who joined us today. Mental Health Colorado is your voice for healthier minds across the lifespan, and your experiences inform and guide our work. We need to be increasingly understanding and compassionate with ourselves and others when it comes to our mental health. We urgently need to close the gap in access to care to the best of our ability by incorporating practices of self-care into our daily routines, by being mindful of each other and attentive to each other's needs. We all have roles to play. There are 3 things you can do today. First, you can give. Mental Health Colorado works hard to promote well-being and shame and discrimination and ensure equitable access to mental health and substance use care. Our life-changing work is made possible by your contributions. We depend entirely on the generosity of Coloradans. You can visit mentalhealthcolorado.org/donate. And second, you can be a voice, a stronger voice, by joining our Brainwave, which is what we call our statewide network of volunteer advocates. Brainwave members help dismantle barriers to care that Coloradans face by sharing lived experience with lawmakers, the media, and community partners. As a Brainwave member, your voice shapes public policy and public opinion. And our Brainwave members help us advocate for the bills and priorities we've mentioned here today. And join us by visiting the website with the /join-the-wave. And then finally, today and every day, do something that's good for your own well-being. In Colorado, as in most places, we have so many diverse ways of taking care of ourselves, whether spending time with family or volunteering or cooking or gardening or rock climbing or hiking or watching the sunset. We're inviting all Coloradans to think about the big and small ways we take care of ourselves and how those small moments add up to improved well-being for each of us. Where do you find joy? Visit our website at mentalhealthcolorado.org/what's-your-piece to show how you support your well-being and inspire others. Again, I want to thank all of our sponsors: Colorado Access, the Colorado Community Health Alliance, Health One, Johnson & Johnson, Mental Health Center of Denver, and Signal Behavioral Health. And a special thanks to our presenting sponsor, Rocky Mountain Health Plans. Please stay connected with us, follow us on social media, and visit our website, Mental Health Colorado. A full list of the bills Mental Health Colorado is supporting is available at mentalhealthcolorado.org/2022 legislation. You can just point your camera at that QR code to find that page. And if you sign up for our newsletter, you'll get regular updates. And if you're a member of our Brainwave, we'll be mobilizing you to help provide testimony in support of this work. Thank you again so much for being here today. Hope you enjoy the rest of your day. Thank you again, Dr. Medlock. It's great to have you with us.
Okay.